everybody. It's Julie here from Fundamentals Physio Therapy and Wellness Clinic. It's Wednesday night, technically midweek, so we are almost done. And we're here to talk tonight about your knee joint. Basically teaching you how your knee moves, what makes up our knee, the mechanics of the knee, so that hopefully you can kind of understand why you have knee pain, or if somebody you know that has knee pain, any of your kids have knee pain with sports or activities, things like running, soccer, jumping, basketball, that sort of thing. So if you do happen to catch this live and it helps you, great. If you know anybody that this will help, please feel free to tag them and let them know to check out the video. So the knee is a pretty complex joint, probably one of the most complex joints in the body, I would say, because it's made up of so many different tissues and its structure is really neat. And I think a lot of people don't actually realize how the knee functions. And it's really important to understand how it functions in order to kind of decipher what sort of pain and what sort of symptoms you're having and the conditions that you're experiencing. So when we talk about knee pain, there's a variety of different conditions. We can have knee injuries where, let's say, you fall onto the knee, or you twist the knee, and those are going to be your conditions where you strain a ligament. Remember, a ligament is basically the tissue that goes from bone to bone. So it's going to go from one bone to the next bone, and it keeps things nice and stable. We've got meniscal strains. So if you tear your meniscus, meniscus is a tissue in between the center of the knee joint. And I'll kind of explain to you guys exactly what that is. You can fall onto the knee and develop a bursitis, that sort of thing, just an inflammatory response in the knee. So there's a lot of different types of injuries that can occur in the knee, but then we can also have knee injuries that don't actually have an actual mechanism of injury. And what I mean by that is it came on insidiously, meaning, one day you woke up, you went down the stairs and it started hurting. And we see that, honestly, probably very often in the clinic. I would say more often the insidious, no mechanism knee injuries, more so than the actual injuries that somebody's fallen, or they've played soccer and they've twisted their knee, or they landed funny playing basketball, that sort of thing. So if any of you guys do have knee pain, feel free to comment and just kind of say what sort of symptoms you're having. And hopefully we'll talk about those sort of things when we're talking tonight. So common things that people will mention that are pain is, going up and down stairs, squatting, kneeling, twisting, right? In and out of the car, playing sports with their kids, those quick movements, where you're changing direction. If you're running straight and then you twist to the left, that sort of thing. So the knee is something that I want to make sure that you guys understand what it is and basically how it works. It's called a synovial joint. And what that basically means is it's a joint that has fluid within it. And it's intended to have a really good amount of range of motion and flexibility to allow the limb to move. So like, your elbow joint, that has a lot of range of motion. Same thing with your knee. It is meant to be mobile. And it's probably I'd probably say one of the most complicated joints in the body. But it's made up of a couple of different joints, which a lot of people don't actually realize, okay? So I'm gonna draw you a picture, because I like to draw pictures, even though I'm not an artist. So in your knee, you have what we call your femur, okay? So that's your really big thigh bone, right? Underneath it, you have your shin bone. That's also called your tibia, okay? Okay, so femur and tibia. This is the large joint of the knee, okay? Now these little areas are called condyles, and what they basically do, when you bend your knee, they go like this. When you straighten your knee, they open up, they close down. When you bend your knee, they open up. Okay, so they slide and they kind of glide on one another. Now, in between those two joints, right, we have cartilage that's kind of on the edge of each, but on the top of your tibia, I'm sure, who's heard of their meniscus? Has anybody heard of their meniscus? If you have, throw it up in the comment section. I want to see who's actually heard of their meniscus. Now, your meniscus is a thicker part of your cartilage, and it's meant to basically provide a smooth shock absorption that basically makes the joint really kind of glide frictionless, I guess you could say. But it also is a shock absorber, because when you walked, if you didn't have cartilage and a really thick meniscus, imagine how much pounding would be going through those bones. Probably wouldn't feel very good, right? So this is your meniscus, and it's a really kind of thick area. But there's two pieces to it. So you actually have a medial or inside meniscus, and then you have a lateral meniscus, okay? Some of them get good blood supply, some of them don't. Now, in and around this area, you've got kind of like a capsule, okay? And it keeps all the nice fluid in and around that joint, okay? Now, the other joint, remember how I said there's two joints in the knee? The one that everybody always forgets is what we call your patella femoral joint. We call it PFS. Patella is your kneecap. So it's a little circular bone. You know that bone that nobody likes to shimmy around? That sits on top of our thigh bone. Okay? Now that joint, it is, how would I describe it? The underside of the patella, the patella we think is flat, right? But on the underside, it's actually kind of curved, and it's supposed to sit in a specific groove on top of the femur. But you guys all caught that I said supposed to, right? Right? So that's the patella femoral joint. And there's muscles that attach to that patella that move it up and down. So when we straighten our knee, it pulls up. When we bend our knee, it pulls down. So it goes in different directions depending on how we're actually moving our knee. And then we talked about ligament injuries. So ligaments, if you remember what I said about a ligament is where two bones are joined by a tissue to keep it nice and stable. So you've got a ligament on the outside, a ligament and then the inside, and then you have two inside, which I'm sure you've heard before, your ACL and your PCL. So they're actually inside the joint, okay? And people say, well, what do the ligaments do? The knee joint is a joint that needs to be stable, okay? Stable means a lot of structure and a lot of stability. So you've got your femur and your tibia, okay? So your MCL is a ligament that goes from the bottom part of your femur to the top part of your tibia. If you think of a band that went from here to here, it stops you from going like this. Your LCL is on the outside of your leg. It goes from, same thing, bottom of the femur, but to the outside of the tibia. It stops your leg from going this way. So you know sometimes when you're running and you're playing soccer and somebody goes like this and your leg goes, oh, that's when you hurt your MCL, okay? And then we talked about ACL and PCL. So they are inside the joint, okay? So one goes from the front, ACL, front of the tibia, to the back of the femur. So if you think of a band that went from back here to here, it's gonna stop your shin bone from going forward. PCL is the opposite, front here, front of the femur, to the back of the tibia. It's gonna stop here. So you know the soccer players that blow their ACLs, usually it's because Joe came out of nowhere, hit the back of their leg, their tibia went forward, and tore their ACL, okay? So those are the four ligaments that basically make up the stability in the knee. So those ligaments keep those two bones from shifting around, okay? So that's typically how we injure ligaments is, you know, you trip or you fall, or somebody kicks you, or you step off something funny and you twist more than the ligaments can hold. So as soon as you twist too much, the ligament pulls, and then you have a ligament strain or tear or whatever. Usually very treatable. Now, there's a lot of muscles that surround the knee, okay? You've got your quad tendon. I'm sure everybody knows their quad, right? That comes down and attaches into the kneecap. You've got other versions of your quad. You've got this like vastus lateralis, so this muscle that comes down on an angle. You've got your vastus medialis obliquus, which comes in here, and then you've got these adductor muscles that are your inner thigh. You've got your IT band, which is that tissue up here. Anybody ever heard of their IT band? Runners out there, maybe? Now, when we talk about knee pain, let's talk about that insidious onset, which I have people message me all the time. Anybody here have knee pain that they didn't actually specifically have an injury? Amber, yes, we know you do. So insidious onset is really commonly seen, and usually it's due to some sort of an imbalance of what's going on in your body. So something's too tight, or something's too loose, or something's not stable. Okay, so do you remember me talking about a couple weeks ago? I did a talk on flexibility, mobility, and stability. So in order for us to function properly, we need to have really good flexibility in muscles. So the muscles have to be long so that the joints can move the way that they should be. So if something's really tight, it could be limiting how your joint is supposed to move. Mobility is the ability of the joint to have its full range. So that knee joint to be able to flex and extend all the way. And then stability is the ability of things to be nice and stable when they need to be. So the knee joint, because it doesn't have a lot of muscles around it, it relies a lot on stability. It needs stable. It needs it, or else it doesn't function properly. But the joint above it, which is your hip and your ankle, they are more mobility and kind of flexibility joints, and strength is also important. But in your hip, if you don't have full mobility and full flexibility in your hip, it can have a huge impact on your knee. Okay, so let's just talk about something that's really common in people. So if you have pain with squats, stairs, kneeling, anything that's kind of a weight bearing and bending motion of the knee, I want to kind of explain to you what could be contributing to that. Okay, so we talked about the knee needing stability, right? So if we think about like the knee and the kneecap, what we see a lot of is runner's knee, IT band syndrome, sometimes bursitis, that sort of thing. If things are pulling your knee out of the alignment that it's supposed to be in, or not providing it to be in the correct alignment, you're going to start having symptoms. As an example, the other day I had somebody who came in with actually that I did a virtual assessment with for knee pain. So they were getting a lot of inside kneecap knee pain and occasionally some outside kneecap pain. And what I was looking at, I had to take a look at her hip, her knee, and her ankle, because they're all going to contribute to that knee stability. So when I took a look, I addressed her quad tendon, because if her quad tendon was too tight, it's going to most likely shift her kneecap up a little bit higher than it should be, right? If it's tight, it's going to pull that kneecap upwards. It definitely was a bit tighter than I'd like. Her IT band on the outside was really, really sensitive to touch. And the farther up that I went into her hip, it actually was pretty sensitive too. Basically where the IT band attaches into her TFL muscle, she had a lot of sensitivity up there as well. And then what I did is We looked at the flexibility of that. Her hamstrings were great. Her calf length was fine. There was no issues there. So we were talking about the knee, but then I said to her, well, let's just see how stable you are standing on one knee. So I got her to stand up, and I kind of looked at her balance, and her balance on her left leg was great. And then I got her to balance on the right, and she was kind of like this. Now, I'm not sure. Do you guys see a discrepancy between me like this on my right leg versus this with my left leg? Anybody see the difference? And if you do, what do you see happening? So here's my left, and this was her on her right. She was shifting to the right. So that kind of gave me a flag, okay? Because our hips are supposed to stay nice and level. But she was compensating and kind of over here. So then I got her to do a squat. And her knees kind of went like this. And I said, did that hurt? And she said, yes. I said, okay. I said, can you do a one-legged squat? And I said to her, I said, okay. So she squatted like this. It was fine. Any knee pain? No, just some tightness, that sort of thing. And then I asked her to squat on her right leg. And she was like, ow. Like she was like this. She couldn't control where her leg was. I looked at her foot. She was one of those individuals that has a little bit of a flat foot, but also pronated. So her lower leg, because her foot was turning in, she was starting to get this tibial rotation. And then because of her hip, she couldn't stabilize her hip and keep it locked outwards. It was just drawing inwards. So she was like this, completely like wobbly, couldn't hold it. But do you remember how I told you that the knee joint has to be very, very stable? Yes, the knee's going into valgus, yeah. So valgus is where we start to see like a shift in the knee, almost like an inward shift. So she noticed that right away. I said, do you feel the difference between the two, the left and the right? And she's like, yes, I can't even do it on my right. So her knee had no stability because she was losing it in the hip and in the ankle, okay? So what that's telling us is, now I did some strength tests for her knee. I checked the strength of her quads. I checked the strength of her hamstrings. She was fine. Like there was no issues at her knee. I did some resisted tests, different angles with her quads. It wasn't too bad unless I pushed her kneecap down, or I got her to push her kneecap down, and that aggravated her symptoms. So as soon as I pushed her kneecap down, she had symptoms. So what that was telling me that perhaps when she was squatting, doing stairs, or kneeling, that kneecap was slightly out of alignment. So that's what we call runner's knee or Patella femoral syndrome. It just basically means an irritation on the joint where the kneecap sits on top of the thigh bone. So underneath the kneecap, where it's supposed to sit in that little groove, was just irritated. And why? Because nothing was aligned, right? So if the kneecap, when she's doing activity, it's veering in like this, but she's got this, the quad pulling it here, the IT band pulling it here, so she's getting this shifting of the kneecap because the alignment, which is supposed to be nice and straight when she does squats, knee should go over the second toe. She wasn't getting that. She was getting such a misalignment of everything. So I talked to her about what could be contributing to that. So we did a couple of glute strengthening, glute tests. I asked her to bridge. She could bridge pretty fairly. It was a regular bridge, and it was two-legged bridge, and it wasn't very indicative of one side versus the other side. So I got her to do a one-legged bridge. The left, she could hold 15 seconds, not a problem. The right, she could barely get that bridge all the way up into extension because of a couple of different things. So she was lacking glute control on that right side. And people say, well, what did glutes have to do with anything, right? your glute muscles, you have a couple of them. One of them just extends the hip backwards, like when you're running or when you're going upstairs. It's basically that push-off muscle. But then you have the one on the side. That's what keeps your hips nice and stable. And if you remember, what do we say that she did when she was standing on one leg? She did this, right? So your glute med here, it also is, and it's an abductor. So when you balance on one leg, it keeps the pelvis nice and level, but it also rotates your leg outwards. So it's what we call an external rotator, okay? So if you think about it, when she went to squat, she was getting a lot of internal rotation, which probably means that that glute med is not firing when she needs it to. So that's allowing for that internal rotation of our femur. And then the foot, remember I said her foot rolled in? She's getting internal rotation of her foot or her tibia. And then the kneecap's getting pulled out this way because the IT band's so sensitive and probably irritated, right? So she's got this valgus of her lower extremity versus when she does this, she's got good alignment. So what we talked about at the end of our consult, I basically wrote her report, what my findings were. She has a little bit of pronation in her feet, so either footwear or good, foot recruitment exercises. We talked about the glute weakness, the lack of stability and sense of control in the knee, because it could be a motor control issue too. Just that connection between her knee and her brain just aren't controlling things. So we talked about techniques that she could do to improve that sense of awareness of where her knee is when she's actually doing activity. So what we have to remember is in the knee, because it needs stability, that proper alignment helps to reduce a lot of people's pain symptoms, but also strong muscles that are supposed to support the alignment also help to reduce symptoms. Okay, so when we do a knee assessment on a virtual platform, I'm looking at functional activities like your balance, your squats, your bridging, your one-legged bridging, your muscle flexibility tests. I'm looking for what's not looking correct or what's different between the two sides. And then hopefully what we're looking for is what could be contributing to your symptoms. So like that individual, it was lack of glute control. She had some flexibility issues in some of the muscles surrounding the hip and the knee that we're addressing. We also talked about her foot, her feet and footwear, and then just the motor control and that awareness of where her knee is when she does activities. So knee issues are common. We see them all the time. They're treatable. So if you ever have any questions, or if anybody has any questions right now, feel free to throw them up in the comment section and hopefully I can help. There's easy exercises that we can show you how to do at home. Muscle stretches to improve flexibility. Mobility exercises to try and improve the mobility in the joints, especially the hip joint, because it's a multi-planar joint that requires really good flexion, really good extension, really good external, internal rotation, and it also abducts and adducts. So it's that ball and socket joint that needs a lot of movement. So that's what we're going to be talking about tomorrow night, is the hip joint, and basically kind of what sort of movements it's supposed to have. And how it can have an effect again on the knee, but also how it can have an effect on your low back and your SI joint. And there'll be separate talks as well. But basically the knee is a complex joint. It's really cool because the most of the time that I see patients, I'm not actually treating their knee, I'm treating their hip and their foot to help have resolution of their symptoms in their knee. So if you guys ever have any questions, feel free to reach out to me or our team at the clinic. You can follow us on Instagram at fun_physio. Continue to follow our workshops. We have one tomorrow night that's on the hip joint, just explaining the mechanics of the hip joint. And then Sunday night, Mother's Day, we are doing a big talk on one of my favorite topics, what most of us don't want to talk about. So we'll be talking about pelvic health. So if you guys know anybody that does have any pelvic health issues, feel free to let them know that we're doing the live workshop, just to teach people how their pelvic floor works and why we have symptoms, whether you're postpartum or not postpartum, male or female, it's all relevant. So if you have any questions, feel free to message us. If you need a virtual appointment, give us a call. Our number is 905-576-5065, and the calls are answered all day, except when we're sleeping. So we wish you guys all the best. Everybody stay safe, stay happy, be patient, and to all of those moms out there, happy soon to be Mother's Day.